How Marijuana Affects the Brain video by Arthur Jackson Jr., psychic student of Post University. What is marijuana? Marijuana is a mind-altering psychoactive that produced by cannabis sativa plant. Marijuana has over 480 constituents. The THC is believed to be the main ingredient that produces the psychoactive effect. What is its origins? Marijuana is grown in the United States, Canada, Mexico, South America, Caribbean, and Asia. It can be cultivated on both outdoor and indoor settings. What are the common street names for marijuana? The common street names for marijuana are Aunt Mary, BC Bud, Blue Toe, Broom, Chronic, Gangster, Gabba, Herb, Hydro, Indo, Joint, Mary Jane, Moto, Pot, Reader, Symptom, Skunk, Smoke, Weed, Inverter. What does marijuana look like? This is a marijuana plant. This is what it resembles. Marijuana is a dry, shredded, green-brown mixture of flowers, stems, seeds, and leaves from the cannabis active plant. The mixture typically is green, brown, or gray in color and may resemble tobacco. What is it abused? Marijuana is usually smoked as a cigarette called a joint, or in a pipe or a bong. It is also smoked in blunts, which are the cigars that have been emptied of tobacco and filled with marijuana, sometimes in combination with another drug. What is the effect on the mind of marijuana? When marijuana is smoked, the active ingredient THC passes from the lungs and into the bloodstream, which carries the chemical origins throughout the body, including the brain. In the brain, THC connects specific sites called cannabinoid receptors on nerve cannabis and influences the activity of those calls. Many of these receptors are found in the parts of the brain that influence pleasures, memory, thought, concentration, sensitivity, censorship, and some perception and coordinated movement. The short-term effects of marijuana include problems of the memory and learning, distorted perception, difficulty in thinking or problem solving, and a loss of coordination. Now, the effects of marijuana on the perception and coordinating are responsible for serious impairments in learning, association processing, and psychocoordinate behavior driving abilities. Long-term regular use can lead to physical dependence and withdrawal following discontinuation, as well as psychological addiction or dependence. Clinical studies show that the psychological and behavioral effects of marijuana vary among individuals and present a list of common responses to cannabinoids, as described on many scientific literature. These include dizziness, nauseousness, facial flushing, dry mouth, and tremor inactivity, marijuana happiness, and even exhilaration at high doses. In fact, more high school seniors report using marijuana daily, 6%, more than smoking cigarettes, which are only 5.5%, and more than 21% of high school seniors report current marijuana use. The rising use of cannabis in adolescents and young adults raises major concerns. Potential effects on the tragedy of brain monopoly and congestion could be considered cannabis. Cannabis sativa contains 500 identifiable natural compounds, with an estimated 183 million users worldwide in 2017, according to the American Journal of Drug and Alcohol Abuse and the U.S. Health and Human Services. How marijuana affects the brain. In this video, we will explore statistics and scholarly reports substantiating how marijuana and cannabis affects the brain. Cannabis is the most widely used illicit substance worldwide, and legalization for recreation and medical purposes have substantially increased its availability and use in the United States. According to the Center for Behavioral Health Statistics and Quality, in 2015, 2.2 million Americans report use of marijuana. 18 states and Washington, D.C. have enacted full marijuana programming. Legal marijuana is considered the fastest growing market in the United States, currently grossing $21.8 billion in revenue annually for states since 2020. A narrative review titled, "Is the Adolescent Brain Greater Vulnerability and the Effects of Cannabis?" prepared by authors Grace and Blast Hopely, Marco Cozzeni, and Vincent Gibiancho, and Sagnit Bihachara for Frontier.org, concluded the following facts. During the periods of adolescence, it is critical the neural development period, which cannabis use during the period could lead to brain structural, functional, historical alterations that may underpin some of the long-term behavioral and psychological harms that are associated with it. The endocannabinoid system is in relation to the brain, performs a key regulatory and homeostatic role that undergoes development charges during adolescence, making it potentially more sustainable to the effects of exposure to cannabis during adolescence. Marijuana has been used for thousands of years, although referred to in Chinese medicine as early as 2700 BC. It was not until 1850 that marijuana was added to the U.S. pharmaceutical and considered part of the mainstream medicine in the Western world. According to the DEA, Drug Enforcement Administration, in 1970, the Controlled Substance Act declared that marijuana a Scheduled I substance, which by classification deems it as having currently accepted medical use with no demonstrated safety profile and a high potential for abuse, and considered it dangerous due to its potential severe psychological or physical dependence, according to the DEA.gov. In an article entitled "Marijuana on the Mind, the Impact of Marijuana on Conjunctive Brain Structure and Brain Functioning, and Related Public Policy Implications in Behavior and Brain Scientists" by Stacy A. Gruder and Kelly A. Sugar. An overview of recreational marijuana. Impact on the brain. Nothing issues and policymakers to consider, including medical marijuana. Key points of the impact of marijuana on the brain and memory include the following. Recreational marijuana use relates to poor conjunctive across the numerous domains, particularly executive functions and memory, as well as alterations in the brain and structure and function, and earlier age of marijuana's onset use during adolescence, as well as a higher frequency and magnitude use, relate to further impairments Medical marijuana may confer a unique impact on the brain given that marijuana consumers are often adults who are beyond critical neurodevelopment periods and who may also seek products based on the therapeutic potential rather than for mood-altering effects. Safe guidelines for frequency and magnetic use of marijuana potency and the use of concentrates are critical considerations for policymakers. However, further research is needed to facilitate the informed decision-making of these policymakers. A report by Boyd Van Hel, Bill Yossi, and Sologaki in 2016, Sologaki in Boston in 2008. In their cross-sectional studies have constantly documented impaired verbal learning and memory in heavy marijuana use. Adolescent marijuana users exhibited similar verbal learning difficulties as adults. Long-term heavy marijuana users, despite less cumulative exposure, providing evidence that the developing brain may be particularly vulnerable. In addition, adolescent marijuana users have demonstrated poor story memory relative to age-matched control participants. According to Lorenzo Sawagi and Yuso, 2016, advanced reprogramming and advanced techniques provide the opportunity to examine the impact of marijuana on several aspects of the brain structure, including gray matter and white matter. Gray matter is composed of neutral cell bodies and is responsible for information processing and decision-making. A recent review of 23 neuroimaging studies by Lorenzo, Sawagi, and Yoder in 2016 reported that the regular marijuana users constantly exhibit reductions in gray matter volume across brain regions, particularly in the hippocampus of the brain. In contrast, marijuana users constantly exhibit reductions in gray matter volume across the brain regions, particularly in the hippocampus. In contrast, marijuana users generally have larger cerebral and striatal volumes. These somewhat mixed findings are consistent with a previous review in which authors reported bidirectional structure and imaging findings dependent on the brain region under investigation. However, in general, regions commonly altered in marijuana users are typically those with high densities of CB1 receptions, according to Lorenzo, 2016. Furthering, several studies have linked gray matter alterations to increased executive dysfunctions. According to Minia and Talbot, 2010, Impulse, Churchill, Lopez, Larson, and Youngen in 2010, and poor verbal memories, suggesting that structural alterations negatively impact the cognitive. What are its overdose effects of marijuana? No deaths have overdosed. No reports of deaths have overdosed of marijuana have been reported. What drugs cause similar effects? Hadith are also drugs made from the cannabis plant that are marijuana. Hadith consists of the THC-rich resistant material of the cannabis plant, which is collected, dried, and then compressed into a variety of forms, such as balls, cakes, cookies, and other products. Pieces are then broken off and placed in pipes or mixed with tobacco and placed in paper in pipes or cigars and smoked. The main sources of Haddish are the Middle East, North Africa, Pakistan, Afghanistan. Haddish, or liquid hash cannabis called oil, is produced by extracting the cannabinoid from the plant material and solvent. The color and odor of the extractant vary, depends on the solvent. A drop or two of the liquid causes a cigarette is equal to a single marijuana joint. Like marijuana, Haddish and Haddish are both Schedule I drugs. What is the legal status of marijuana in the United States? Marijuana is a Schedule I substance under the Controlled Substance Act, meaning that it has a high potential for abuse, not currently accepted medical use and treatment in the United States, and a lack of accepted safety for use under the medical supervision. Although some states within the United States have allowed the use of medical marijuana, it is the U.S. Food and Drug Administration that has federally authority to approve drugs for medical use in the United States. To date, the FDA has not approved a marketing application for any marijuana product for any clinical indication. Consistently therewith, the FDA and DEA have concluded that marijuana has no federally approved medical use for treatment in the U.S., and thus it remains a Schedule I controlled substance under federal law. Simpros is an oral equivalent of the THC solution that is used in the treatment of anxiety associated with weight loss in patients who have failed to respond adequately to conventional treatments. Simpros is a Schedule II drug under the Controlled Substance Act. Epilumx is an oral solution of cannabis that has no more than 0.1% THC, used to treat two epilepsy conditions, Dravet syndrome and Lerner-Goldner syndrome. Epidiolex is a Schedule V drug under the Controlled Substance Act. What is the effect of marijuana on the human body? Short-term physical effects from marijuana may include sedation, bloodshot eyes, increased heart rate, coughing, lung irritation, increased appetite, and increased blood pressure, though prolonged may include a decrease in blood pressure. Marijuana smokers experience serious health problems such as bronchitis, emphysema, bronchitis, asthma. Extended use may cause suppression of the immune system. Withdrawing from the chronic use of high doses of marijuana causes physical signs including headaches, shakiness, sweating, and stomach pains, and nausea. Withdrawing symptoms also include behavioral signs such as restlessness, inability, sleep disorders, and decreased appetite. In conclusion, how marijuana affects the brain and memory. We conclude with 3 main points. Recreational marijuana use related to proper cognitives across numerous domains, particularly executive functions and memory. Adolescent and earlier high influence and magnet use relate to further impairment. Frequently use of marijuana can cause alterations in the brain structure and function. References are Marijuana Undermined, The Impact of Marijuana Consumption, Brain Structure and Brain Function, Related Public Policy Implications, Behavior, and Brain Science journals. Stacy and Gruber, Kelly and Sugar. You may email Gruber at McLean, MCLEAN, Hammond, HAMMAND, .edu. That's Gruber at McLean.Harvard, HARVARD.edu to get more information. And this is the conclusion of How Marijuana Affects the Brain and Memory. Arthur Jackson, psychology major, Post University.